here?
Sure, I'm totally prepared.
Can we get one mic?
Okay.
Lawmakers are going to be filtering in through here in the next 45 minutes. If we can show our signs and our support so they know what we're here for, that would be really greatly appreciated, okay? My name is McKee. I am a Behind the Walls member from there. I'm also a co-chair of the Super PAC. I'm an overdose survivor. I am also a person who serves on the COGRE, which is the Center for Opioids and Biomedical Research. I'm the state lead for Rhode Island for the Recovery Advocacy Project, and a few other things. But I thank you all for being here today. This is an issue that we've been talking about and has been in the works for 3 years now, 3+ years now. And thankfully, we've gotten some good news today. It's being heard in the House Chairman Casey's committee on Friday, which means that it looks like the safe injection facilities is slated to pass this year. We will be the first in the nation, should this happen. And it looks pretty good. Right? So this wasn't without everybody's collective efforts in this space, right? So in the last few years, we've seen researchers going and sharing data with lawmakers. And we have a world-class university right up the street that comes down the street and shares their findings with people. People, I think most importantly, with lived perspicacity who have survived overdose, who have gone and shared their experiences and how grateful their families are that they're still with us. Unfortunately, there are other people who have not survived overdose whose family members have come forward and spoken with lawmakers about what that feels like. And that's why we're here, right? On top of that, we've had emergency room physicians who are working at Rhode Island Hospital going and talking with our lawmakers about evidence-based policy that we know saves lives. So in the last session, I'm not gonna lie, it's been pretty successful. We just defelonized simple drug possession charges last week. And that was largely in part due to Senate Leader McCaffrey, as well as Senate President Ruggiero. Scott Slater on the House side and House Speaker, Shikarchi, I'm a terrible public speaker. We've also decriminalized Buprenorphine, which is something that we know affects people who are actually feloniously charged in past history. 300 people every few years or so for their own medication, right? That's medically assisted recovery medication. Squashed. No more, right? No more. So tonight we're having our final poll because are we done? Are we done? No, we're not done. And there's strong indication from House leadership after passing this bill, which we're talking about, which is the Harm Reduction Center's bill for 3 consecutive years now, mostly unanimously, which is amazing, right? To get this bill through on the House side and save lives. So when we're talking with people, we're not meeting people where we're at. So we encourage people to engage in treatment when they're ready to engage in treatment. But this is honestly the most, the scariest time for people. And if we're embracing substance use disorder as a medical condition, we can no longer deny people while they're in the midst of that medical condition access to care. And that's what the heart of this bill is all about. It's meeting people where they're at, right? And saving lives. This has been statistically proven to save lives in other countries. I'm really proud to be here, and I'm proud of all the work of the people who are around us and all the good efforts that you put into this, because without that we wouldn't be here. So my only ask, and I'm going to start introducing our speakers who are coming from a place of lived perspicacity, because our speakers are largely, with the exception of our House sponsor, Right Edwards, who's also directly impacted, people who come from lived experience. And the way to get this solved, because the ones who are closest to the problem are also closest to the solution, and there is nothing about us without us, because we are the lived experience experts on this matter, and we know better than anybody around us, right? So I'm just gonna ask of this group in between now and Friday the bill is gonna post, is gonna get out of committee more than likely. we just need you to buffer that and reach out to your House lawmakers to get this out, like on a floor vote. Reach out to them. Please tell them your stories. They're a great group of people. We've got the best lawmakers, I think, in the country. They're extremely compassionate to this issue. They've listened to our stories. They've looked at us with compassion and empathy, and they've heard us, and they continue to hear us. And I actually believe that we're going to be the first state in the nation to pass this absolutely crucial law. So thank you very much.